The CDC is warning healthcare facilities to be on the lookout for an emerging and drug-resistant fungus. It is known as Candida Auris or C. auris, and it can spread easily from one person to another. The infection can also be severe, even deadly. The Fox Medical team, Beth Galvin, joining us live right now with what we need to know about this fungus. Good morning to you, Beth.
And good morning to you, Maria.
So there is a lot going on here. Talk to us about this. What is it?
So C. auris is a fungus that's in the yeast family, and it is concerning to the CDC because they consider it sort of an emerging pathogen because it first surfaced in Japan in 2009, and since then, you know, it is now in about 30 countries, including the U.S., where it surfaced in 2015. And there's real concern about it because, you know, it can affect already vulnerable patients who are in hospitals or nursing care facilities who are already battling other medical issues, you know, and causing these pretty severe bloodborne infections or wound infections, you know, so it's something that the CDC is really sort of tracking and trying to keep an eye on and trying to get the word out because it can sometimes be hard to test for this type of fungus.
Do we have any information related to how this develops and then how it spreads?
So we know how it, you know, there are several different strains of it there that are concerning. 4 of them, I think, that have individually spread. But, you know, this is the first time. The real concern about it is that this is a multi-drug resistant fungus. So it does not sometimes respond to some of the mainline antifungal treatments that they're using to treat infections like this. And so, you know, it can be very problematic. And when we talk about spread, it can exist outside the body on your skin. And so it is possible that, you know, a patient may be able to not know that he or she is infected and then pass it along to another patient, infecting them. So sometimes it can be hard to you know, even know that somebody has this this fungus and be able to stop it before it, you know, it begins to spread in a nursing home or a healthcare facility.
So you're talking about concerns for people who are older in nursing homes or facilities of this type. Is anybody else especially at risk here?
So most at risk are going to be people who are already fighting other medical issues, who have maybe a weakened immune system. You are at higher risk if you're somebody who has like a central line in, like you might have a central line to put medications in you. You might have a breathing tube, things like that, that can, you know, allow the infections to get into your body or allow the fungus to get into your body internally. Those people are at the highest risk. But really this can happen, Maria, to anybody at any age, you know, all the way from preemies, you know, to people who are quite elderly, but most problematic for those who are already sick, you know, and fighting something else.
And very quickly, could you just list some of the symptoms that people might want to be aware of?
Yeah, so this can cause blood-borne infections. It can cause wound infections. It can cause ear infections. So typically you're going to see symptoms that might be confused with something else like fever and chills. And typically if it doesn't, that infection doesn't seem to respond to antibiotics, that might be a time when they need to start testing for this fungus.
Beth, thank you so much for joining us and giving us this updated information.